My name is Bingda, and we are E-Carebetics with a mission to eliminate all preventable blindness in the world. So today, there are over 500 million people in the world that have diabetes. And about 30% of them develop DR, or diabetic retinopathy, one of the most common cause of blindness. And over 90% of the DR patients actually living in developing countries. Early diagnosis and treatment can stop the progression and prevent the blindness, but people in the developing countries are not getting this early diagnosis because of three major problems: lack of affordable screening tools, lack of access for the patient, and the lack of doctors to perform the screening. Here is a flowchart of the problem. So the diabetic patients go to their first point of contact, but they have to be referred to the eye doctors to conduct the diagnosis for diabetic retinopathy. However, at the eye doctors, there is a significant shortage of them, and due to the high cost of the device, time for each diagnosis, and the inconsistent accuracy, it is creating a significant medical burden and poor outcomes for the patient. And so here, E-Carebetics can stop the flowchart right at the first point of contact and creating a better outcome. So how E-Carebetics do this? E-Carebetics enables healthcare workers the capability to conduct DR screening using a mobile app combining AI, software, and a mobile-compatible ophthalmoscope. So we're turning the most used smart device, which is the mobile phone, into a medical device. So the time spent for each diagnosis is reduced by over 77%. And based on our study, the accuracy of the diagnosis increased by 20% compared to doctors doing the diagnosis. And the scope is compatible with over 95% of the smartphones. And so here is how E-Carebetics do this. The doctors or the medical workers use the E-Carebetics scope to take the image, and the image will be uploaded onto the software. Then immediately you will get the detailed diagnosis of the disease. And our first market will be focused on India. India is home to over 21% of global blindness, and we're expecting to have over 150 million diabetic patients by 2045. And imagine 30% of them will develop diabetic retinopathy. And 1 in 2 diabetic patients is undiagnosed currently, and we estimated that the total addressable market for us is over $300 million. And so also, Indian government is launching this new digital health mission that recently launched. Will be giving each citizen a health ID that will connect the patients, the healthcare insurance, and also the hospital to digitalize the whole medical system. And so we can take advantage of this opportunity by compatible with this health ID and making not only take advantage of this large population using the smartphone, but also making the follow-ups and reimbursement process much more easier. And so with all this data involved, data security is definitely our top priority. And our software is developed under HIPAA compliance. And with multiple authentication layers, we're trying to use these multiple authentication layers to provide the data protection. And there are several alternative options currently that doctors are using. The first one is the desktop fundus camera. Due to its high cost and low portability, it is poorly adopted in developing countries. And these two, the middle two, binocular indirect ophthalmoscope and direct ophthalmoscope are often used. However, as you can see from the video, they are very complicated to use, and also they cannot be digitalized. And if you look at this video here, the doctor has to be uncomfortably close to the patient just to get a small portion of the retina looked at. And so there's also a handheld ophthalmoscope that some of them can attach to the mobile phone. However, they have electronic component involved, making them not only highly cost, but also delicate. So they are not suitable to use in medical camp and traveling nurses in outside of office settings where the environment is often harsh. And so this is how E-Carebetics is being used. This is our first prototype, and it is already creating a 3 times greater field of view compared to the direct ophthalmoscope. And it greatly reduces the time for the diagnosis. And we designed it to be compatible with the doctor's available resources, and it has 0 friction for adoption. And most importantly, we reduced the cost compared to many of the competitors by almost 25%. And here are the 3 strengths that we have to create this barrier of entry. So the first one is first mover advantage. We're the first product that combines the mobile app, the AI app, with the mobile ophthalmoscope, and we're currently applying for a patent to protect it. The second is the proprietary data set. The data set we have to train the AI model currently are mostly from developed countries and Western countries, which does not represent the Indian ethnicity. So we have a team of local ophthalmologists to give us the most representative data set and continuously train the AI model to provide the best possible diagnosis. And the third is our novel illumination technique. We can create a consistent imaging condition without the outside environment changing, that without any electrical component involved in this scope. And our business model is subscription-based. We have a different plan for different size of the organization. And we also have a rewarding program that will be incentivize the doctors to provide us more diagnosis and data by helping them pay less for the patient. So it's a share more, pay less kind of a rewarding program. And here is our go-to-market strategy. We have already identified our target market, and our value proposition is we are enabling the medical professionals with AI-powered diagnostic tool to reduce the fragmentation in the diagnosing process and reduce the time for the patient to receive the treatment. And we're still working on the pricing strategy with many of our mentors from LifeX, from Project Olympus, and we are partnered with regional distributors to help us distribute the product. And so here's what we have achieved, and here is what we are looking to do. So we have conducted the customer discovery process from the NSF I-Corp program and developed the first prototype and validated it. And we will be finalizing the minimum viable product and a patent and also apply for patent and regulation. And we'll be conducting more testings to collect data and feedbacks. And we're expecting to commercialize in the fall 2023. And this is our team. I'm a biomedical engineer, Dev is an electrical engineer, and Mukunthan is a data scientist. And we also have a team of mentors and advisors from clinical settings and also business and industry veterans that are helping us along the way. And we also welcome you to join us as well. Thank you.
Can I ask you a quick question? In your business plan, you had mentioned some angle limitations, some inability to get into certain parts of the retina. Mm-hmm. How effective is your methodology until you overcome those limitations and produce a more fulsome product, for lack of a better word?
So currently, our product is already able enough for doctors to conduct the diagnosis. And this angle, kind of sort of angle, is inherent to all the direct ophthalmoscope. As we can see, I don't know, I will change back to the slide here. So this is actually what the direct ophthalmoscope looks like for a doctor. That's only a very small portion of the area that can be seen by the doctors. However, what we can do here is we created the scope that can take a look at the whole. That's actually the image that I conducted using our scope, the whole area of the retina. So that's almost 80%, 80 to 85% of the whole retina, and we are currently working on to even widen it by developing this new illumination technique, as we can take a look at it here. So this is the illumination technique that we can widen the area that we can take a look at in the retina. And this is also part of the patent that we are looking to apply.
So this is near and dear to my heart, having gotten vision screening in the Pittsburgh Public Schools. So one of the issues that we had when we take the vans to the school is we can't dilate the kids' eyes for obvious reason and send them back. Does your technology identify new and additional issues, for example, in children? Or are you really looking at diabetic retinopathy and other issues like that?
So yes, we actually, one of our target customers is pediatricians. And the patient we are targeting is actually premature babies. So there are millions of babies that are premature each year, both in India and also in the US. And they have to be checked by the pediatricians for the retinopathy of prematurity. But the pediatricians doesn't do the diagnosis. They have to refer the patients or let the eye doctors to conduct the diagnosis. So we are enabling the pediatricians to help them use the device to diagnose.
So you're sort of a screening tool, not necessarily a diagnostic tool, but you identify an issue, and then the medical professional actually makes the diagnoses.
Yes, so the medical professionals will take the diagnosis, the screening, and we will provide a diagnostic report to them. Yep.
Thank you.
Yep.
So it seems like there's two things there. One is the collecting of the data through the camera, and the other is the AI diagnostic,
Yes.
which could be performed by a doctor.
Could be, yes. So the thing is, the doctor you referred there is only an eye doctor. We're trying to let the nurses do it. We're trying to let the paramedics do it.
Well, so I guess I have one question: is how accurate is your algorithm in comparing things like false positives and negatives?
Oh, yes, we actually have a... Mukunthan is actually our data scientist, and I would like Mukunthan to explain more on that.
Yeah, so currently we tested with the current public data set. So we are still collecting the data set, customized data sets, but we built a model with the public available data sets, and we tested several approaches, and we got average 90% accuracy on that one. Now, but we are still getting more data, especially with our devices, and especially in India. So once we get it, we can improve. Our target is achieve 95.
We have been using public available data for training our model, but the thing that I just mentioned about our strength is that we worked with local doctors to collect the most updated.
More
the
they
most
have the
representative.
rewarding to get more.
Yes.
Right.
Yes.
So
they
maybe
will-
my follow-up question is, what other indications would you apply this to? Maybe macular degeneration, glaucoma?
That's a
or
really
anything
good
else?
question. So we actually have two other models for age-related macular degeneration and glaucoma. So we are currently also working on that. But for this pitch, I want to focus on diabetic retinopathy. But that's our next pipeline. Yep.
And could you say, how do you price, how are you planning on pricing, like real dollars? Like,
So-
how does that work?
Yeah, so in terms of pricing strategy, we are still working on that with our mentor. But our cost for the whole scope is about $20 to $30. And we are looking
$20 to $30.
$20 to $30 for the whole cost. Yeah. So it's just very low. It's very low. And
Plastic, right?
yeah, it's just plastic and a lens. The thing is, what's making it different is that we combine the different designs into the scope, making it not only making the imaging clear, but also consistent. Yeah.
Also, if I can mention, yeah, we have strategic partnerships.
Yeah.
Yeah, you can. Yeah, we have strategic partnership with local lens manufacturers, which are providing us lenses at 10 times less cost than the lenses that are available in the market. And the result that we are able to get through those lenses is pretty much compatible. That puts us in a good position to lower the cost for our product.
Any more questions?
How accurate could just the newest model iPhone be without any other additional hardware?
How accurate?
Yeah, could you diagnose without?
Without, like you can't see it.
You wouldn't be able to get
Like if you just use the raw camera to take it, yeah, you can't see the retina. Yeah.
Thank you very much. Yep.